Darier disease, also called Keratosis follicularis, is a rare skin condition that usually starts after puberty. It makes the skin feel rough and develops small, wart-like bumps. The problem comes from a single gene called a TP2, a 2, that is passed down in families. The disease is caused by a change mutation in the ATP2A2 gene. This gene makes a calcium pump that helps skin cells stick together. When the pump does not work, the cells separate and the skin becomes flaky. The mutation is inherited in an autosomal dominant way, so a child only needs one parent with the change to get the disease. Triggers such as heat, sweating, stress, or certain medicines can make the rash worse. Typical signs include small, greasy-looking, brown-yellow bumps on the chest, back, neck, and scalp, crusty patches in skin folds that may smell, thickened, ridged nails that look like they have tiny pits. A practical way to picture it is to run your fingertip over the back of your hand and feel a sandpaper texture that is similar to the feel of a Darier bump. Occasionally, itching or burning sensations occur. A dermatologist usually diagnoses Darier disease by looking at the skin and taking a tiny skin sample that shows characteristic cell changes. A genetic test can confirm the ATP2A2 mutation. Treatment focuses on controlling flare-ups. Topical retinoid creams, for example, adapalene, help skin cells grow normally. For more severe cases, oral retinoids, such as low-dose isotretinoin, are prescribed. Gentle cleansing, moisturizers, and avoiding triggers keep the skin calm. If a patch becomes infected, antibiotics may be needed. Patients are taught to apply sunscreen and keep the skin dry after sweating. You cannot change the inherited gene, but you can lower the chance of flare-ups. Practical prevention steps: wash skin gently with mild soap and pat dry. Use fragrance-free moisturizers after bathing. Avoid long hot showers, saunas, and heavy exercise that makes you sweat a lot. Wear loose, breathable clothing. Limit alcohol and avoid medicines known to worsen Darier, for example, lithium. Manage stress through relaxation techniques or counseling. These habits act like a protective shield that keeps the skin from reacting. Recent research is exploring new ways to treat the underlying cause. Scientists are testing small molecules that improve the calcium pump function, which could reduce the need for high-dose retinoids. Early-stage gene editing. CRISPR studies in lab cells have shown that correcting the ATP2A2 mutation can restore normal skin cell adhesion. Clinicians are also using digital photography apps to track rash severity over time, helping personalize treatment doses. While these advances are promising, most are still in clinical trials and not yet widely available.